Good morning. I'm Mike Paulus. I'm the president at Sequentia, and we're here today to talk to you about what Sequentia is and many of the questions that we've fielded from you. And so we're going to have some answers from our founder and CEO, Jerry Luce.
It's good to meet you all. I've had the pleasure of spending some time with you in person over the phone. You've asked a lot of questions, and we're going to answer all those questions. And if you have any additional questions, you can pick up the phone and call me direct at 440-258-2322.
Great. Thanks, Jerry. Jerry, let's start with the obvious point. What is Sequentia?
Sequentia is a transition of care platform. It's designed to transfer patients from hospital to post-acute care. What we want to do is make sure the patient journey is as close to perfect as possible. So the best possible care, quickly, effectively, and most cost effectively. At the end of the day, we want the patient, our family members, our friends to get back on their feet and live a normal life. And to do that, we help the hospital transition a patient from the moment they walk in to the moment they leave the hospital, post 90 days, making sure they've got the very best possible care.
Great. Great. So how did you come up with the idea, and how did this all get started?
Well, that's interesting. My background's marketing and advertising. I spent most of my career working with professional athletes and stadiums and advertising and PR. And we had an episode where a loved one, my wife's 90-year-old grandmother, fell in her home. Ended up receiving fantastic care at a hospital system in Ohio, and unfortunately we had some issues with transition. We moved this poor woman 3 times over 6 months until we really found the best post-acute care provider. It was emotional, it was frustrating, it was stressful, and I don't want anyone to go through what my family went through. So we built a system from scratch, from the ground up, working with hospitals and post-acute care providers, so no one experiences what we went through. It's personal. We're going to make a difference in healthcare. And today, after 2 years of testing, working with hospital systems in Ohio, we've got a product that is absolutely stellar.
Mm-hmm. Great. So what can you tell me that makes Sequentia different, unique, and better than other things that may be out there?
Well, I'll tell you, first and foremost, we spent 18 months working and walking through hospitals, through post-acute care providers, to understand the holes in the floor, the frustrations and the issues they face in transition of care. We also took into consideration patients and caregivers, what they go through during this time in their life. It's a bit of a crisis. It's very emotional. So at the end of the day, we spent a lot of time making sure that whatever we launched across the country is going to work, it's going to make sense, and it's going to benefit everyone involved. I think that is incredibly important to understand, because the idea didn't come from a back office, behind closed doors. It's working with people, hospital, nurses, doctors, post-acute care providers, families and caregivers. And at the end of the day, the system was developed taking into consideration 100% what everyone in transition of care needed and wanted. We built it and we launched it.
Well, as you talk about transition of care and that entire process as it relates to now the view of episodes of care rather than discrete care segments, what are the primary benefits and value that Sequentia brings to the hospitals as the starting point?
The hospital system is focused on doing good for the patient, doing good for the caregiver, the family. I believe that wholeheartedly, holistically. The reality of the situation is we're here to help the hospital during a time that is emotional, during a time that is a bit frantic. So what we do is help the hospital understand the patient need. We identify high risk for readmit. We address all the holes in the floor the hospital experiences. Everything from a financial standpoint, from an information sharing and gathering standpoint for family members and patients. We connect the dots. So for hospitals, we help them with workflow, we help them with connectivity, we paint a very detailed care path for the patient. We help to eliminate wasted length of stay, improve HCAHPS scores, address readmits, reduce readmits, and make sure that the patient, from the moment they walk in to the moment they leave, is going to the right facility the first time with the best possible care.
And related to that, obviously, at the back end of the system are the post-acute care providers. What are the big key values and benefits that Sequentia provides for the users from a post-acute care standpoint?
Well, at the end of the day, one of the biggest, really one of the biggest things that we do to help post-acute care is make sure that they have the information necessary to assess whether or not they can care for that patient. Care for your loved one, care for your friend, and care for them in a way that is proper, necessary, and needed. So no more guesswork. No more guessing, do I have all the information necessary to look after, Grandma Gustovich. The reality of the situation is we provide real-time information, it's accessible, it's in their hands when they need it, and they can decide and make an educated decision on caring for that patient or not caring for that patient based on real-time data. We want to make sure that that patient gets to the right facility or home health care provider because based on their ability to care for them medically, but also to care for them personally, especially if they have a long-term stay, a rehab situation. At the end of the day, let's make it feel like home and let's connect post-acute care with patient based on medical need and personal want.
Yeah. The third major group of people involved in transition of care is obviously the core group, the patient themselves and their caregiver family members who are making the decision of what post-acute care provider is selected when they're transitioned out of the hospital. What is unique about Sequentia as it relates to the patients and that part of the process?
It's an excellent question and an important question. At the end of the day, patients, caregivers, family members should be at the center of care. From the moment that they're admitted to the hospital to when they leave the hospital and end up in post-acute of any type. So the reality is we give the patient and the caregiver the information necessary in a timely manner to make an educated decision for their loved one. Where is the best place I should put mom or dad or grandpa or grandma based on real information, and be able to do so and share that information with family members across the country, be able to do so in a manner that allows the needed and necessary time to make such an important decision, to give them the 2, 3, 4, 7 days, 2 weeks time frame to be able to pull the trigger based on that information. It's key. 24 hours, 36 hours before discharge, it's difficult, it's painful. So how about now having a week, 10 days, to be able to make that decision and trusting a family member and their care to a stranger. I'm really happy and very proud of this capability and this piece of the business because that is what we did not have when we went through our personal experience. It was not, it wasn't easy. Now it is. It's real time, and honestly, truthfully, it is focused, patient and caregiver centric.
Well, those three groups, the hospitals and the post-acute care providers as the healthcare component and the patients, obviously there's one other group that is intrinsically involved here, and that's the payers, the insurance providers. How does Sequentia impact or benefit insurance providers?
At the end of the day, insurance providers do care about their insured, their members, and what we want to do is be able to provide information that is actionable to the payer, the insurance company, so they can help their patients travel or make the decision for that care plan. The best facility, the best type of care, the best cost. At the end of the day, we're able to provide that information to the insurance company that they can share with their insured members and say, look, the best thing we could do here in this geography for your loved one are the post-acute care providers. So take the guesswork out of it. Yes, do the due diligence and spend the necessary time to get to know these folks before you make that decision, but at least we can provide the insurance company a list of appropriate care providers that they can share with members, patients or caregivers, so they can start that research, they can start that due diligence and make the very best decision and feel good about that decision, not concerned, boy, not sure if it was the right choice or not. The reality is, the information is there, given to them by the insurance provider, so they can make that right decision and feel good about it.
Obviously, Sequentia has to tap into a source for the patient data and the patient information, and obviously that is the hospital's electronic health record system or electronic medical record system. Is Sequentia different than an EHR or an EMR?
Absolutely, it is very much a very different piece of technology. It's a resource tool that works in conjunction with the EMR, the electronic medical record, or the ADT, the admission system, to pull and populate information that will help determine the patient and their health care journey. So we don't replace EMRs, we work with and augment the capability to make sure that the patient gets the best care, the most appropriate care, at the best facility or home health care provider, and do it in a way that is real-time and connected and accessible by all involved in transition, all involved in that patient's care.
Obviously, in the past recent years, there's been a tremendous amount of increased federal regulation on healthcare, and more is coming down the pike, and there's a new administration coming in that's talking about significant changes to things like the Affordable Care Act. How is the regulatory environment going to change in a way that will impact Sequentia, and will that be a positive change or a negative change, or how do you see that impacting the Sequentia platform?
You know, there's a new administration coming in. Changes to accountable care will take place. The amount of time it's going to take for those changes to be enacted, what those changes are. At the end of the day, Sequentia delivers indifferent of policy, indifference of who is sitting in the Oval Office, delivers a solution that identifies a major opportunity, a major problem, but really a true opportunity to improve healthcare and transition of care. So I can tell you with some serious and some firm confidence that changes will occur, but it will not affect the value that Sequentia provides in transition of care, because it's absolutely necessary today. It's a bit disconnected, it's a bit disjointed, and we define and clearly lay out a path for any patient based on their specific care need, by geography, what is the best process or path for that person. Indifferent of policy, indifferent of who sits in the Oval Office, that is still a massive and major need today to ensure that patient, our loved ones, our friends, get the best care the first time, period. So changes will occur in accountable care. I see no negative impact in what is coming down the pike under this new administration.
Is it accurate to say that with all the other regulation well beyond the Affordable Care Act that govern things like readmissions and the federal government and Centers for Medicare and Medicaid trying to drive down the cost of an episode of care, is it fair to say that those regulations are not going to be impacted and will still continue to drive the need for a good transition of care solution?
Absolutely. The reality of the situation is we have to provide the right care the first time at a better cost. 17–18% of our GDP is spent on health care. That is financially devastating to the country. So how do we give the best care, the most accurate care, the first time, and do so in a way that makes sense financially for everyone involved? It's about process. It's about real-time information sharing. And I can tell you, my personal belief and what we're hearing from our consultants is the need to improve and drive down accuracy is key, and that is not going to change. Not going to change at all.
Okay. One last question, Jerry, regarding the entire view of payment, and one thing that has emerged recently is the changeover from the traditional fee-for-service for hospitals now into value-based care, and obviously the emergence of the bundled care payments, which have started and driven into lower joint related activities, and also then now moving into cardiovascular, and the projection is for that to increase across the board. Do you see that entire bundled care initiative expanding and positively impacting a system like Sequentia?
Without a question of a doubt. Sequentia will positively influence hospital, post-acute care, performance, and financial betterment in that environment. Bundle payment, it's going to address or affect the majority of diagnosis codes, DRG codes. So to your point, lower joint, hip knee replacement, cardiovascular, moving into others, that's the wave of the future. That's how we're going to control cost and monitor performance. And the reality of the situation is Sequentia, both on the hospital side and the post-acute care side, will help drive that objective. It is very good that we're moving in that path, or towards that path, across all DRGs or most of the DRGs. And the reality is Sequentia is going to be a very valuable partner to acute and post-acute care in that payment environment. But importantly, and most importantly, it's going to help patients, it's going to help caregivers make the right decision for that specific patient, our friends, our loved ones, our families. It's not guesswork. It's not a decision made last minute. It's going to be able to, without a question of a doubt, provide all the information necessary to make sure that patient goes from A to B and they do it right the first time.
Great, great. Well, thanks, Jerry, and thanks to all of you, and we look forward to any other questions that you might have about Sequentia.
Thank you very much.